I'm Stephanie Hertz, Marketing Director here at Workforce Retirement Community. Today, I'm sitting in the Workforce Independent Living area, and I have the pleasure of introducing Dr. Pankajavalli Ramakrishnan. Dr. Ramakrishnan is a graduate of the prestigious Medical Scientist Training Program at the Albert Einstein College of Medicine in New York, where she earned her MD, PhD. After a medical internship at Columbia University Medical Center in New York, she completed the Harvard Partners Neurology Residency Program at Brigham and Women's Hospital and Massachusetts General Hospital, where she also remained for fellowship training in vascular neurology. She completed an additional fellowship in interventional neuroradiology at Emory University Hospital and Grady Memorial Hospital, Atlanta. Dr. Ramakrishnan is board certified in neurology and vascular neurology by the American Board of Psychiatry and Neurology. Recognized by Coastal Virginia Magazine's 2016 Top Docs list, Dr. Ramakrishnan is not only a highly successful stroke neurologist and neurointerventionalist, but also an accomplished author, clinical research investigator, lecturer, and educator. A compassionate, effective, and fully engaged physician, she is an expert in the identification, treatment, and prevention of problems of the brain and spinal blood vessels. Dr. Ramakrishnan grew up in northeastern U.S., but now enjoys the seasons, history, arts, and culture venues of coastal Virginia. Her favorite hobbies include traveling, reading, and exploring other cultures and cuisines. Workforce hopes you will enjoy today's topic concerning brain health and stroke.
Good morning. Thank you so much for the introduction and for the opportunity to meet with you all to talk about stroke. So none of you ever have to come for treatment, but can be staying vigilant about how to prevent stroke, which is really the crux of this talk, and be aware of stroke symptoms and seek immediate medical attention, okay? So I'm a stroke neurologist and neurointerventionalist at Riverside, which is a comprehensive stroke center. And this is a picture of our building, and every year we have met the highest quality in stroke care, and we have, again, this is 2020, but now we also have received the 2021 recognition for providing the highest level of care for stroke. So, we are very honored to have this privilege. It's something that we strive to earn every year, and we've been very glad to have this honor bestowed yearly for the hard work that all our team puts together. So how big of a problem is stroke? Well, stroke is a brain emergency. It's a neurologic emergency. And every year there are about 800,000 strokes just in the U.S. Stroke is the 5th leading cause of death. It used to be number 3. So where we have made an improvement on average is that we have saved people from dying from stroke, but it still remains a big problem. In Virginia, actually, it still is the 4th leading cause of stroke. So Virginia is not as good as the national average. So we need to take it seriously and work hard at minimizing its impact. It's a long-term cause of disability, and 3/4 of all strokes occur over the age of 65. So if you flip that number, 1/4 of the strokes are happening in those under 65. A big problem across the ages. The risk of stroke doubles every decade after the age of 55. So this is a problem that affects all of us, either as people who suffer stroke or as people who become caregivers for patients with strokes, or as community which has lost a productive member of the society to stroke. So you can see it's a big problem. I think this actually drives home this message. This is a map of CDC. CDC updates this map really every 2 years. And what this map is of people who have had strokes and dying from strokes in the year 2017 to 2019, a county-by-county map. It's a heat map of where people are dying from stroke over the age of 35. So if you see these purple areas, they're all hotspots, and these purple-most areas fall in a very localized geography called the stroke belt, okay? Terrible place. And Virginia is very purple, especially in the parts that we live. So we really have to do better. And this map is of those people dying over the age of 35 from stroke. So you can see it's a problem that affects even people who we don't normally think of as being at risk for stroke by age. So how many reasons do you need to take this seriously and do something about? Well, I told you it's the 5th leading cause of death in the U.S. It happens every 40 seconds, the stroke. And every 4 minutes, somebody dies of a stroke. We already heard that it's the leading cause of disability and that it costs us all a lot of money. In 2010, we paid about $74 billion for stroke-related medical costs and disability. That number is even higher now. 80% of strokes can be prevented. That means 4/5 of strokes never need happen if we did all the things that we could to protect ourselves from it. And the goal of the talk is to focus on that today. And as you can see, 60% of the strokes occur in women, 40% occur in men. So it's a little bit more women skewed as far as demographics is concerned, something to keep in mind as well. So we're going to go through some common misperceptions of stroke and see if we can eliminate them from our thinking, because that is a barrier for both preventing strokes and also for seeking treatment if somebody were to have symptoms. So the first myth is that stroke cannot be prevented. You just learned that 80% of strokes can be prevented. So keep that in mind. That's one of the key things to dispel. There is no treatment for stroke is another myth. That's actually not true. Many strokes can be treated provided you know the signs and symptoms to watch for and call 911 right away, because treatment can completely reverse any permanent disability and you might have just survived effectively the consequences of stroke. Another myth, stroke only affects the elderly. Well, you saw the statistics that I already showed you. 1/4 of the strokes happen in under 65. So strokes can happen anytime. It can even happen in utero, but we're talking adults here. So it can happen to anyone. Another myth, stroke happens in the heart. No, stroke is a brain attack. It compromises blood flow to the brain and causes damage of brain function. That's a stroke. Another myth, stroke recovery only happens for the first few months after a stroke. It's actually not true. Stroke recovery is lifelong. Why is that? Well, your brain is a thinking, learning machine. Just think back to your own experiences. You were born, you learned to walk, you learned to talk, you picked up skills along your life, you are in good employment, you have hobbies. You were not born knowing any of that. Those are all things that you learned by practice and practice over and over again. That's because your brain is a thinking and learning machine. So recovery from a stroke happens because your brain learns new functions, things that it didn't know how to do before, and parts of the brain that were not responsible for loss of function, now it's able to learn them and facilitate recovery. So stroke recovery can happen lifelong. Another myth, strokes are rare. Well, you saw the numbers again, didn't you? 7 million people are stroke survivors in the U.S. And even though this fact sheet is old, for Virginia, stroke is the 4th leading cause of death. In the U.S., it's the 5th. So it's very common. Another myth is that strokes are not hereditary. Again, this is more nuanced. Truly genetic strokes are rare. However, how do we form our habits, particularly with eating, drinking, lifestyle? We learn it from a young age by watching our family members, our parents, aunts, uncles, grandparents. We eat the same kinds of food, the way they're prepared. It's very comfortable. It's also comforting. But the way we were doing things were not the most healthiest. And then it's no surprise that if older relatives in the family had strokes and younger relatives are having strokes in the family and everybody's had the same habits, it might look like you have strokes running in the family, but it's not because of genetics, it's because of same habits. So keep that in mind. That's a big one. It's a big one because you have control. This plays a key part in 80% of strokes being preventable. Okay, myths. If stroke symptoms go away, you don't have to see a doctor. Well, that's actually wrong. Stroke symptoms that go away are a warning sign to you called a TIA, transient ischemic attack. They are warning signs prior to an actual stroke happening, and in 15% of the patients who have a TIA, they go on to have a stroke within the next 2 weeks. So imagine you're being given a warning shot saying you need to go see your doctor right away, go to the hospital, get your act together so you don't have a stroke. I mean, why would you miss that opportunity to avoid a lifetime of disability? So take TIAs and temporary stroke symptoms seriously. Okay, so we talked about stroke being a neurologic emergency. Most strokes occur due to blockage of blood flow to the brain. That's the majority of stroke types. Some strokes also occur because the blood vessels have ruptured, causing bleeding in the brain. That's called hemorrhagic stroke. The stroke due to blockage is called ischemic stroke. They're both serious types, both are emergencies, and both need immediate medical care. And you might actually do many things in your life and health that can make it entirely preventable and treatable. So here is a cartoon of what it means to have an ischemic stroke. Here is a cartoon figure whose blood vessels going up to the neck and into the brain are shown. They're all different branches. And what happens is a plaque or a clot goes and blocks right up here. This is that spot before this artery branches into two further branches. What it's doing is preventing blood flow here, and what's downstream of this blockage is this area of the brain. If this area of the brain gets blocked for blood supply, that's going to die. And when it dies, it has a stroke, and that stroke is called ischemic stroke. Again, another cartoon showing what a hemorrhagic stroke is. Here is a cartoon brain. Blood vessels are going up into it. And brain, like most structures, has multiple layers of covering, starting here with the skull. The next are the leathery covering of the brain, called the dura, and other additional layers called arachnoid and pia, fancy words for just coverings of the brain. And if you have blood within the skull and the covering, different layers of coverings, they're named for the location where the bleeding is. If it happens in the brain, then it is intracerebral hemorrhage. If it happens within the folds of the brain, it's called a subarachnoid hemorrhage. Needless to say, blood vessel has burst, either because it couldn't withstand the pressure or because it had an abnormality like an aneurysm that popped and then caused bleeding all over. Again, resulting in hemorrhagic stroke and causing devastating brain injury. So let's talk about ischemic strokes. Ischemic stroke and TIA are things to think about together. They both happen because a blood vessel is blocked, and when no blood flow happens, no energy goes to that part of the brain, and those areas, the brain cells die within minutes. You don't have a lot of time. If a part of the brain dies, whatever it was responsible for controlling in your body, you lose that function. So if blood flow to the speech area of the brain is blocked, you can't speak. You may not understand. If blood flow to a part of the brain that controls your right arm is affected in the brain, then you may not be able to move your right arm. You get the idea. So strokes come in all manner of sizes. And size is only a single data point of knowing whether that stroke is going to have large consequences or not. So, for example, you can have a large area of the brain, and everybody here would say, yeah, that means that you are going to have a big loss of function because it's affecting a big part of the brain, resulting in a large area of stroke. However, the converse is not true. You can have a stroke in a small area of the brain, but if that collects a lot of information, then it can still affect a big part of your function, and you can still have a clinically devastating stroke. So the size of the stroke is not enough to determine the extent of deficit. It also depends on the location, okay? This is really the reason why I hate using the word mini stroke. It's like being mini pregnant. It does not exist. You had a stroke, it either left you with a lot of deficits or not a lot of deficits. And same thing, TIA, transient ischemic attack, another corruption of parlance. I had a mini stroke. I don't know what that means. Does that mean it was a TIA where no evidence is left behind and you recovered from the stroke without any assistance? That's a TIA. If a small area of the brain was affected or a big area of the brain was affected, it can still be a TIA. So it may not be a mini stroke at all. So I would discourage everybody from using that and instead say you had a stroke or you had a TIA but not mini stroke. I mentioned earlier that 15% of TIAs go on to having strokes with permanent brain damage. And what happens when you have permanent brain damage from a stroke? This area of the brain has had a stroke, it died, and when it died, it lost a lot of neurons. Up to 2 million neurons per minute are lost for a lack of blood flow per minute. I am going to take a brief pause here. I'm getting paged, so I will resume in just 5 minutes. Okay, you're good. Hi, everyone. Thanks for being patient. So let's talk about this concept. How many neurons die when there's no blood flow to that part of the brain? We think that a bare minimum number is 2 million neurons. So when somebody starts having stroke symptoms, be it from bleeding or from blockage, you're losing neurons every minute by several million. So it behooves the person having stroke symptoms and the people near them to call 911 right away, because if this is the part that's starting to die, like a fire spreads from in to out, the areas of the brain that are in progressively lighter shades of blue are at risk of dying as well. So you can see that what could have been just a small stroke from which you might have a better chance of recovery, now you have gone on to having a much bigger stroke from which chances of meaningful recovery become really slim. So this is the key for why we make the emphasis to say, if you are having stroke symptoms, call 911 right away. Don't second guess. Don't wait to see if it gets better. Same thing with TIA. It might just be that it was so small that your body got rid of it, but the next go around, it's going to become much bigger. So this picture should be, full of importance to you all, and that's why it's here. So call 911 right away when you think that you might be having stroke symptoms. What happens when somebody does suffer a stroke? Does the brain age more quickly after one? And the answer is definitely yes.
I'm sorry to...
Back to this slide. So you all heard me say the importance of why you need to call 911 is because this dead area of the brain can continue to grow outward to encompass a larger part of the brain and develop a much bigger stroke. So the minute you recognize that you might be having a stroke because of some symptoms that we'll go over, it's time to call 911 because brain is dying and dead neurons don't come back. So for every hour that the brain is without blood flow, it ages much more quickly. So that means that for every hour without treatment, your brain becomes 4 more years older. So you might be 55 years old with symptoms, But if an hour has gone by, your brain is already 59 years old. 2 hours, you do the math. 5 hours, wow, 20 years older than what you are, so that's a big impact, okay? So keep again this in mind for why it's so important to call 911 right away. So let's review some symptoms. What can stroke look like? And this is common to both ischemic and hemorrhagic strokes. So if you have sudden numbness or weakness of the face, arm, or leg, especially on one side, if you have sudden confusion, trouble speaking or understanding, difficulty seeing in one or both eyes, trouble walking, dizziness, loss of balance, sudden severe headache without a known cause. All these things can cause or can be the cause of a stroke. You do not need to have them all. Any one of them will do. And this is not a comprehensive list, but these hit the big stroke symptoms, okay? Is there a good way to remember many of them? And the answer is with this mnemonic, be fast. Stroke and TIA mnemonic. Each letter stands for something that you need to pay attention to about it being a stroke symptom. So if you, B is for balance, E is for eyes, so anything to do with impaired vision. F is for facial droop. A is for arm weakness, but remember, leg also falls into this. Just keep that in mind, not just the arm, but also the leg. Same thing with sensation. And S is for any manner of speech. It could be impaired articulation, it could be impaired comprehension, or being able to express yourself clearly, or all of the above in speech. And T is for time to call 911, as well as for terrible headache. If you're not a headache sufferer and you're suffering from the worst headache of your life, that could be a sign of stroke. It's a rare sign of stroke, but it could still be a sign of stroke, so you need to call 911. And again, you don't need to have all of these symptoms. Any one of them will do. Same, be fast for TIA as well. So what do you do if you're experiencing any of these warning signs? Note the time when the symptoms began, if they began abruptly, and call 911. If you're not the one that knows for the person who's suffering from the stroke, note the time that you discovered them. That's not the time when the symptoms started. You just happened upon them and you knew that that's what you're seeing. Again, important to be very precise in how you communicate, but either way, call 911. Don't stop. Do not wait for symptoms to improve or to worsen. Okay. So what can we do if you do have an ischemic stroke? There are many ways we can treat this. Most important aspect of the treatment is to seek immediate medical attention, and that's by calling 911, not by calling your doctor that you go to see regularly, not even by calling your stroke doctor if you have one. You just call 911 and go to the hospital. Immediate treatment after symptom onset is what determines how well you do from the stroke. Some patients may be eligible for a clot-busting medicine called IV alteplase, or also known as IV TPA. It's FDA approved to be given up to 3 hours, and in some cases can be given as late as 4.5 hours from the symptoms started. But that's like saying, you have 4.5 hours to put out a fire. We all know that doesn't make sense. You put out a fire as soon as you see one starting. It's the same idea for stroke. The sooner you diagnose, the sooner you might be able to start the treatment, which means less disability. Not everybody can be eligible for this, but if you don't come, you can be assessed for it. It's like if you don't play the lottery, you can't win. Okay, so quick treatment improves your chances of survival and lowers your chances of complications, okay? So that's the take-home message from here. And these are just some examples. So if a blood clot is blocking a blood vessel to the brain and you're having symptoms such as can't move the left arm or the left leg, your eyes are looking one way and you're slurring your words, you're not paying attention to one side of your universe, these could all be signs of stroke. And such was the case in this patient, where you can see this blood vessel is supplying blood flow to the brain with these branches all getting blood flow. But this one is abruptly cut off. There's no flow beyond this point. So this patient is a real-life patient who came in and had this blood clot removed from this part with a stent retriever, a type of tool that we have to remove blood clots. And after its removal, you can see all the branches being restored with flow. So this is a successful immediate treatment and called mechanical thrombectomy, and we do this here all the time. But again, you need to be eligible. Your eligibility goes way down if you come really late from when your symptoms started. And this is offered for people who have blood clots in large blood vessels of the brain and in the neck. Okay. Not everybody would be eligible for these treatments because it's not the right fit, but there could be other treatments that they may be a candidate for, provided they come in again in a timely manner. Some people may need other procedures or surgeries to open up arteries in the neck, or procedures to put a stent in the neck to, treat the narrowing caused by fat buildup in the arteries. And by treating them, you can minimize the chance of another stroke. So what this means is somebody who's had a stroke is at risk for another stroke. So very important that you take the stroke that somebody's had seriously and try and do everything to prevent another one. Blood thinning medications can also be given to patients, and they are really broad in their categories, and these are just some examples. This is not all encompassing. Aspirin is one, Plavix is another one, Coumadin, Eliquis, Xarelto, many other agents. People also have high blood pressure, high cholesterol, diabetes, smoking, recreational drug use, excessive alcohol use, sleep apnea, obesity. I'm listing all of these here because those are all things people can control, and each one of them is a risk factor, an independent risk factor for stroke. So if you can control all of this, you would have achieved an 80% risk reduction in all the preventable reasons for stroke, okay? If you prevent a first stroke or recurrent stroke, it requires a lot of, working with your regular doctor on all these measures. So, it's important to know your health, and it's important to seek the appropriate care for your health. Okay, so some of these slides are just a breakdown of what I just talked about. So lifestyle is a big one. Your doctor cannot do it for you. Your loved one cannot do it for you. Only you can do it for yourself. They fall under the category of modifiable risk factors for stroke. So being overweight or obese is a risk factor. So very important to do what you can to lose weight in a healthy fashion. Physical inactivity is a big cause, and that is, easily remedied by walking about 30 minutes a day. Don't have to sign up for boot camp, gym. Just walking 30 minutes is a good way to do this. And this does not mean that the walking that you do while at work is, counted towards this. While you're at work, you're not continuously walking 30 minutes, most of us. And besides, you're, focused. Your mind is not clear. When you just go walking for the sake of walking, you are not preoccupied with other concerns. And that is part of, improving your overall physical and mental health, which can address your stroke risk factor. Binge drinking, heavy drinking, they're both risk factors. Again, important to address this. Illicit drug use avoidance, such as cocaine, amphetamines, habit-forming drugs, even the ones that you get over the counter. People use and abuse cough syrup, for example. Cigarette smoking doubles the risk of stroke, and that also includes the secondhand smoke. So very important to take measures to protect yourself from this. The modifiable risk factors where you have a medical condition. So these include high blood pressure, high cholesterol, diabetes, sleep apnea, and heart disease. So blood pressure over 120/80 increases the risk of stroke by 1.5 times. Diabetes, 4 times. And a condition of the heart called atrial fibrillation, 5 times. So again, very important to work with your doctor to screen for some of the things that can be screened and treat for the ones that can be treated. High blood pressure is ubiquitous, and there are many things that can be done, and that includes exercise, managing stress, achieving a healthy weight, limiting salt intake, alcohol intake, and prescribing medications to control the high blood pressure. Okay? And keeping a blood pressure journal is a very good way to let your doctor see how well the medications are working. So I encourage you all to do that, so that way you have a day-to-day assessment of your blood pressure, not just the one that you get when you go to the doctor's office, and your doctor can better treat you this way. Other aspects of stroke prevention: eating less cholesterol and fat-rich foods, especially those with saturated and trans fats, which can influence fatty buildup. Remember, we talked about arteries building up with cholesterol. This is part of that. Weight loss, improving your diet so it has 5 or more servings of fruits and vegetables. Do this, but don't defeat this by adding a whopping amount of salad dressing. Okay? People often say, oh, I only eat salads, and then you dig a little bit deeper, and you've got these mayonnaise-rich salad dressing, and you have just thrown all the good things that you've done out the window. Regular exercise, 30 minutes of activity every day. Walking would be a very good place to start. Smoking cessation, avoiding illicit drugs, and sleep apnea is a big one. So if you are told that you snore, your partner snores, please take it seriously, because when you're snoring, your brain is not getting oxygen, and eventually it sets in motion your risk for stroke. And stroke is, again, avoidable, and obstructive sleep apnea is a treatable condition, minimizing the risk of stroke. Okay, now for non-modifiable risk factors. It's important to know this, but realize that you can't control this, which is why it's so important to focus on what you can control. So what are these non-modifiable risk factors? Personal or family history of stroke, TIA or heart attack, age 55 or older, can change your age. African Americans have a higher risk of stroke by 2 times. So do Hispanics and Asians compared to Caucasians. More women die of stroke than men. You saw that in one of the early slides. And women have a higher lifetime risk of stroke than men, partly because they also live longer than men. Okay? So I touched on some of the medication strategies, but again, this is very individualized. It's not a one-size-fits-all. This is just an overview of some of the tools that we have to treat people for stroke prevention. That includes medications that make it difficult for platelets to form blood clots. These would include typically things like aspirin or Plavix. There are other ones too. Things that can minimize clot formation, other medicines called anticoagulants like Coumadin or Eliquis. Blood pressure lowering medications, cholesterol lowering medications known as statins, diabetes medications, CPAP machines, smoking cessation aids. Again, sounds simple if you think about it, but it's important to work with your doctor for some of these things. So, stroke is preventable. Big take-home message. The other one is stroke is treatable. So, if you are experiencing signs and symptoms of stroke, you need to call 911 right away, because that's the quickest way to get treatment. Don't get in your personal vehicle. Worse, don't drive yourself. Call 911. Some assessments may be made in the ambulance, and some treatments may be arranged, or at least some of the pathways started by the EMS teams by communicating effectively with the hospital to which they're taking you. Every minute saved in stroke treatment gets you another 1.8 days of healthy living. Every 15 minutes saved is 1 extra month of healthy living. And remember, ischemic stroke patients may be eligible for clot-busting medicine called IV-TPA up to 3 hours, and in some cases even up to 4.5 hours if they are eligible. This is an old cartoon. It shows how to spot a stroke by using the mnemonic FAST. Remember to use the mnemonic B FAST to add balance and vision trouble. Okay, so we'll focus on a few more slides, and that's going to be on hemorrhagic stroke. And here, again, a cartoon of the brain with blood vessels going into the brain, in the base of the brain, and around the brain. And either way, if this blood vessel cartoon showing it ruptured, it can cause bleeding inside the brain or around the brain or under the brain, okay? Any of these would be a hemorrhagic stroke. It accounts for 15% of all strokes and responsible for over 40% of all stroke deaths. So again, needs to be taken seriously. It can be due to a ruptured aneurysm, a malformation, or just a regular blood vessel because it couldn't handle the blood pressure anymore, or it had become weak over time. Hemorrhagic stroke also damages brain cells, increases the swelling and pressure in the brain. The common causes are high blood pressure and aging of the brain blood vessels, abnormal aging of the brain blood vessels. Other causes could be trauma, people having bleeding disturbance, and people who need to be on blood thinners, but sometimes they can cause brain bleeds if they are overactive or people may have taken too much of it. So the most common cause of intracerebral hemorrhage is high blood pressure. So again, remember that as being one of the key things to work with your regular doctor if you have high blood pressure. Other ones are trauma, and subarachnoid hemorrhage can also happen because of a ruptured brain aneurysm. And things that can influence brain aneurysms to rupture, grow faster, and recur even if they're treated are those people who smoke cigarettes, those who binge drink, those using recreational drugs, and those with high blood pressure. These factors are under your control. That's why they're listed here. Other ones you cannot control. There are treatments, but again, treatments depend on coming in quickly and being eligible for treatments. So the focus is to find the cause of bleeding and treat it to prevent rebleeding. One of the key components is to lower a high blood pressure if it's discovered on examination. Somebody might be on blood thinning medicines, but if they had a trauma and if they had a brain bleed, the blood thinning medicine didn't cause the trauma, but because you're on a thinning medicine, you might bleed more with the trauma. So same idea for other aspects of brain bleed. And we might be able to give medications to reverse the effect of the blood thinning medicine. If somebody has a brain bleed because of an aneurysm or a malformation, they might be eligible for certain treatments that are minimally invasive, catheter-based, or open surgery-based. Some people may need removal of blood clots with surgery to relieve pressure on the brain. And sometimes you need multiple groups of providers and specialties to come together to do treatment, such as catheter-based procedures, such as open brain surgery, such as stereotactic radiosurgery. All these things can be employed, but again, need to come before you might be eligible for treatment. So this is a cartoon of somebody having a brain aneurysm, where in the past, the blood vessel on which this aneurysm lives, it's treated by putting a clip across the neck. The cartoon is easy, but the actual procedure is quite invasive, and what used to be done was shave this part of the head, assuming that's where the aneurysm was, deep inside that side, incise and flip the scalp tissue, and then drill a hole in the bone and remove that part of the bone, navigate to find deep within the folds of the brain where this aneurysm comes in contact with the blood vessel, and put a clip to pinch off blood supply into the aneurysm to exclude it from continuing to receive blood supply. Nowadays, it's done endovascularly, meaning minimally invasive, where a catheter, a hollow tube, is inserted into the artery in the leg artery, sent all the way up to the area of the brain where this aneurysm is by entering the aneurysm through the blood vessel to which it's connected, and deploy coils, which are platinum fine structures, some of them can be as fine as strands of hair, and fill this aneurysm like you would fill a pothole in the road. So once you fill a pothole in the road, it doesn't fill with rainwater anymore. Same idea, when the aneurysm is filled with something from the inside, blood cannot get inside to continuing to fill it, and therefore continuing to pound it to increase in size and causing it to bleed again. This is just one of the methods of treatment. There are additional methods of treatment. I won't go into all of the technologies, but recognize that minimally invasive technologies have become the first line of treatment for aneurysm, and technology being what it is, we are still, we're going to find even more novel ways of treating aneurysms that remain even more minimally invasive. Again, more examples. This is an actual angiogram of a patient with a big AVM with multiple aneurysms connected to this tangle of abnormal blood vessels. Sometimes these big aneurysms bleed within the tangle, so you take care of them first and eventually calm, and then remove blood supply to the AVM by selectively blocking individual paths of these tangle of abnormal blood vessels, and eventually removing it with open surgery or with radiation treatment to shrink it down. So now the last part of the talk is going to focus on some complications that can happen if somebody suffers a stroke, either ischemic or hemorrhagic. They can have paralysis. They can have loss of movement of arm or leg or face. They might develop contractures, which is what happens if your joints become stiff in an extremity that's no longer moving. And once contractures develop, you can have terrible pain. And this becomes a feed-forward cycle where you're not wanting to work with therapy to get better because you have pain, and because you're not moving it, you become stiffer, and the limb becomes more contracted and more painful. So it's very important to work with therapy and get rehab and keep working with them as much as you can. People might have difficulty talking or swallowing, and if that happens, you might have pneumonia, and if you're not swallowing properly, you can't eat. You may need feeding tube, even if temporary ones, just to get through until your throat muscles become stronger. Memory loss, cognitive deficits, thinking difficulties. So again, can be seen after a stroke, and you might need to have cognitive therapy, you might need to make lists and reminders, might need to rearrange what you can do in the way of everyday activity and work based on your new cognitive skill set, cognitive ease of being able to do. You might not be able to do multitasking anymore, so important to recognize your limits. People may have emotional problems, depression. We hear from time to time patients who were, a wonderful human being, joy to be around, now completely ordinary, no filter after a stroke, insulting, inappropriate. The opposite can also happen. So again, behavior can be affected after a stroke, so important to seek attention, clinical attention for help with these symptoms. Same thing with self-care. People may have taken meticulous care previously and now have just decided to not pay attention to these things. And that can affect your hygiene and other aspects of care. People may have more frequent urinary tract infection and bladder control issues, just because the part of the brain that was controlling the bladder to signal when you need it to go is no longer working right. And again, these can be addressed with the help of your primary care doctor and neurologist. Strokes can increase the risk of seizures. Important to seek attention. If that happens, they can develop bed sores in people who are bedbound. So again, very important to have excellent nursing. People can be immobilized and develop blood clots in their legs. They might need additional treatments. So focus after a stroke is on recovery and rehabilitation to improve and restore function so that patients may be able to return to independence. Can take weeks to months, but important to work with physical, occupational, speech, and cognitive therapy because they all play an important role in the recovery of a patient after stroke. And there are modifying risk factors for strokes, and that forms a cornerstone of how to prevent the next stroke, everything that we have gone over. So again, important to pay attention after somebody has had a stroke because you still can make a difference in minimizing the chance of a future stroke. This is one of the most important slides of this talk, and I'm just going to read this because I can't say this any better than it's been said. This is a real stroke survivor's quote. I had a stroke when I was 49 years old. I'm 67 now and have gone almost 20 years without another stroke. Until I had my stroke, I didn't do anything good for my health. I had high blood pressure, I was overweight, and I smoked. When bad things happen to people, they tend to think, why me? But when I think about my stroke, I think, why not me? I had all the risk factors and wasn't taking care of myself like I am now. I've learned a lot of important lessons from my stroke, which have caused me to change my eating habits, quit smoking, and really control my high blood pressure for the first time in my life. I hope people realize they can prevent stroke. It doesn't have to happen to them. TED stroke, stroke survivor. I'm sure you all know who that is. So Take-home message, stroke is preventable and treatable, and hope to not see any of you as people suffering stroke. But if you do, know that you can call 911 and know that Riverside is a comprehensive stroke center, and we offer the highest level of stroke treatment. Again, thank you for the opportunity, and I'm not sure if we have a forum for questions. Happy to take any if necessary.
At the top, there's a chat. If you open that up, you probably have questions in there.
Okay, so chat box question. Is it a good idea to take an aspirin at the first sign of stroke? Excellent question. Just because of what I just went over, strokes can be both bleeding or blockage kind of stroke. You have no way of telling based on the symptoms. So unlike a heart attack where you're advised to take aspirin if you suspect you're having a heart attack, don't do that if you suspect signs of stroke. Just call 911 and get in. Very good question. Any other questions?
There may be some if you scroll up.
All right. Well, it sounds like we are times. Oh, I see. I see one more question. Maybe we'll take the last question here. Well, two last questions. Okay. So stroke screening. Excellent question. Stroke screening, as you just probably realized, is going to be screening for risk factors, right? So work with your regular doctor to see if you have any of the treatable risk factors for stroke. Because stroke is an emergency, it doesn't give anybody an announcement and say, I'm going to come 3 months from now on this date and time. So the best thing you can do to screen is for risk factors for stroke that we went over. Next question, what are the primary ways to distinguish a stroke from a heart attack? The symptoms that we just went over. So make sure to get a BFAST magnet. We might be able to supply some to the CNU audience. And it can also be printed out, put it on a refrigerator, someplace where you can see, familiarize. Not all symptoms are listed, but certainly ones that are important. Certainly the ones that are common, I should say. So there is, I'm going to make this the last question because I'm getting paged again. I must have missed what you said about daily baby aspirin. Actually, I didn't make a specific reference to a daily baby aspirin. The reason I didn't make a specific reference to any medication is because everybody's stroke risk profile is different. So it is important to make sure that you work with your regular doctor to see whether you are somebody who needs to be on certain kinds of medications, including aspirin. Take their guidance. Don't do this on your own. And the absolute last question, I'm sorry, I can't take any more questions because I'm paged for another emergency. A mini stroke does not exist in my book. What is a mini stroke is the question. You either have a TIA whose symptoms come and then they go away before you seek medical attention, or you have a stroke where you had symptoms and it got better. And by the time you come to the hospital, imaging studies confirm that you've had a stroke. All right. Thank you, everyone, for your attention. Really appreciate all of you taking the time and giving me the opportunity. Thank you.